Good morning, gentlemen. Let's discuss the diseases of the nervous system and their natural remedies. Nervous system disease or neurological disorders are the diseases or disorders that affect the functioning of the human nervous system, the brain, the nerves throughout the human body, and the spinal cord. Structural, biochemical, or electrical abnormalities in the nerves can result in a range of symptoms, including our five senses. Everything humans can sense depend upon the functioning of the nervous system. The skeleton and muscles support and transport the body. The digestive system, heart and lungs provide nutrients. But the nervous system contains the epitome of the human, the mind, and it commands all perception, thought and action. Disturbance or malfunction of the functions of the nervous system causes changes felt throughout the body. Although many brain diseases cause disorders of thought or mood, this part discusses only the diseases of the nervous system that have organic causes and of mental disorders. Mental disorder is any illness with significant psychological or behavioral manifestations that is associated with either a painful or distressing symptom or an impairment in one or more areas of functioning. At the beginning of the third millennium, due to prolonged aging, neurodevelopmental disorders are growing and a much deeper knowledge of the brain is necessary. We need to take extra and proper care of our nervous system to make it work best. There are more than 600 neurologic diseases. We will discuss the major ones here. These neurologic diseases can affect the memory and ability to perform daily activities. The ones which we are going to discuss here are Alzheimer's and dementia, Parkinson's, facial paralysis, Bell's palsy, body paralysis, cerebral palsy, epilepsy, insomnia, sleep disorder, schizophrenia or personality disorder, sciatica, multiple sclerosis, MS, motor neuron disease, MND, neurofibromatosis, depression, and migraine. I will also tell you natural remedies along the course for these diseases. Here is a list in order of their cause. They are mainly caused by five main reasons: vascular disorders, infections, structural disorders, functional disorders, degeneration. The nervous system is vulnerable to various disorders. It can be damaged by the following: trauma, infections, degeneration, structural defects, tumors, blood flow disruption, autoimmune disorders. Signs and symptoms of nervous system disorders. Following is a list of most common symptoms of the nervous system disorder. However, each individual may experience symptoms differently. Most common symptoms may include persistent or sudden onset of a headache that changes or is different, loss of feeling or tingling, weakness or loss of muscle strength, loss of sight or double vision, memory loss, impaired mental ability, lack of coordination, muscle rigidity, tremors and seizures, back pain which radiates to the feet or other parts of the body, muscle wasting or slurred speech, new language impairment, expression or comprehension. The basic types of healthcare providers who treat nervous system disorders are neurologist. The medical healthcare providers who diagnose and treat nervous system disorders are called neurologists. Neurosurgeon. Surgeons who operate as a treatment team for nervous system disorders are called neurological surgeons or neurosurgeons. Neuroradiologist and interventional radiologist. This is a radiologist who specializes in diagnosing nervous system disorders using imaging and conditions such as cerebral aneurysms, acute strokes, and vertebral fractures. They also do biopsies of certain tumors. Psychologist. Emotional problems such as anxiety, depression, mood swings, and irritability are common in nervous system disorders. Your psychologist can help. Psychologists may do testing to find out how much your disorder is, affecting the way you think or feel. Psychologists also do talk therapy, that's counseling, to help you deal with the emotional effects caused by nervous system disorders. Psychiatrist. Like a psychologist, this team member deals with emotional and behavioral symptoms caused by nervous system disorders. In most cases, talk therapy works best for these problems. But if you need medicines to treat symptoms such as depression or anxiety, this doctor can help. Physiatrist Healthcare providers who work with people in the rehab or rehabilitation center. Processes are called physiatrist. Physical therapist. This is a movement specialist who can help you move and walk well. In physical therapy, you can also work on painful or stiff muscles and joints. Occupational therapist. This provider helps you learn to handle day-to-day activities. For example, you might have trouble doing tasks you need to do at work or at home. Your occupational therapist may help you find ways to adjust to any changes in your physical abilities. Speech or language pathologist. This provider specializes in communication, including cognitive communication. They also diagnose and treat swallowing problems.